Hi everybody, I am Dr. Qazi. I am a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars and pigmentation, and also a lot with collagen stimulation. And I'm going to keep tonight's episode of my live show as just more of an open format. Just ask me anything. I had a lot of questions over the last few days, which I didn't get a chance to answer. So this is kind of your time. I'll try to my best in 30 minutes to answer as many questions as I can. And more likely than not, I'll probably just keep it more like a free-for-all, just to, expand on a few topics. And feel free to ask me about not just with acne and not just with scars, but also just about the field of medicine if you want, or anything else that's interesting you, because this is more like a free format here tonight. So we'll talk a little bit about some of the questions that I had from yesterday, which were still pending. Some patients were asking me about my thoughts on the best device for scars, the best device for acne, scars in particular. And they were asking if CO2 lasers were superior to erbium lasers. So I want to go into that a little bit more in depth today. Hi, Ruby. How's it going? Because I get that question a lot in terms of just like the type of product. Someone will say that I was recommended this particular laser or that particular laser. Is that going to be the best option for my scars? So it's not about the device per se, but what I use for my practice, I make sure that I have a surgical handpiece for the CO2 laser, and that's how I basically trace around the edges of the scar. And your practitioner may not do it that way. They may just use more like a CO2 laser that's more fractionated, which means that there's these gaps, and there's basically you'll see sometimes in my videos you'll see these little white spots on the skin, and that's where there's basically ablative skin, and then around it there's healthy tissue. And so basically over the next few days, that healthy tissue will help you heal a little bit faster. But then you'll also see some areas where I'm burning down completely, basically a lot of times with those thick elements, those thick parts of the scar. And that's where I use more of that ablative form of the CO2 laser. So it's not necessarily dependent on the different device companies. In fact, I'm totally open to all the different device companies for most of these CO2 lasers, as long as they have those particular handpieces. It doesn't really matter to me otherwise, though. Hi, Nemesio. How's it going? Does microneedling help? So it helps stimulate a little bit of collagen, but not going to help enough for most scars. So I always say that because I want people to know that, if you're going to go consider doing microneedling, don't, purchase large packages of things if you have deep scars, things like that. You may not be able to see enough of an improvement, enough of a result for your types of scars. So definitely, talk to somebody else that does scars a lot, and potentially you may need other options like CO2 lasers, Subcision, TCA Cross, or excisions there. Danielle is saying, hi, doctor, where can I find your Subcision pricing on your website? That varies. So it depends on like the area size. It could go in range, quite a bit. It could go usually for most patients, like from $700 to $1,200. Sometimes with more excisions, it could go up to like $2,000 or so. So it depends on what's happening actually with your scar tissue, how deep it is, and what kind of tools I need to do, how long it's going to take me to do those type of things. The lower part of the face tends to be a little bit riskier, so I have to do I usually use more blunt cannula tools there, and I really go really meticulously in each of those little bonds there. And since there is that's an area that can take a little bit longer, it can end up costing a little bit more sometimes for some people. But again, it just depends on how deep and thick those scars are. But everything else, all of our other prices are on our website. So feel free to go on our website. You go to drqazi.com, you'll see all of our prices over there. Do you see out-of-state patients and do same-day treatments? Yeah, all the time, actually. Today, we had a patient from out-of-state. We have out-of-country patients. So it depends on which state you're in. If you're local, the western states, then you can just fly in and fly out. It's going to be pretty easy for you. Otherwise, I recommend just spending a night, keeping it easy. You just go the next day. And a lot of people will say, well, what about like the airport, things like that? We haven't run into any problems at our airport. And who cares if people see that you did some scar treatments, things like that? It's okay. Nobody's really going to care because it's like whatever you're doing for yourself. Mrs. Jones is saying, hello, doctor. Can you work out a payment plan for patients with limited budgets? Yeah, we do have, we take almost every payment option really. So you could take a look and see from our website, but almost everybody is for bigger packages. They tend to do like things like Cheery or Cure Credit, things like that. Alphion, we accept pretty much all of those. We just wanted to make it so that everybody could just be able to, this is accessible for everybody. It doesn't make a difference. I just wanted it so that no matter what, there's some option available for people. And it's like, I think that, stretched out, payments are stretched out. So hopefully that helps you out too a little bit there. Let's see here. Hi, how's it going? Let's see where Frank is. Frank was asking about, can you do Subcision years after Bellafill and Sculptra? Yeah, you can. There's no problem with that. I mean, I would have preferred that you did the Subcision like properly first, because then it makes it a little bit easier. We could just do some volume replacement a little bit easier. But if you need to, yeah, I mean, if you feel like they're still tethered, it's still stuck, we absolutely can do that. And for those just asking, I'm Dr. Qazi. I do skin restoration. I'm in Newport Beach, California, and I'm just like 5 minutes away from the airport. So we have a lot of our patients. Most of our patients, in fact, are from out of state. We have a lot of patients from Northern California as well. I try to just focus on a few things, and I just do a lot of that. And a lot of people like just see that that's like what we cover a lot is because I just do a lot of those few things. And that's the way I like it. I like just like specializing in a few things and do it very, very, very well. So that way it's just, done at a high level, and our team is like excellent, and just make sure that this is always done really properly, and like the follow-up is properly done. So we can make sure that this is done very, very safely. It's very, very difficult to, maintain these kind of results, maintain like safety results that we were very, very safe. And one of the things that we do is we monitor habits so that all patients send photos to us throughout the whole week. After they do the treatment, they do photos with us. They send photos to us throughout the whole week, sometimes 2 weeks. And the reason why is because we want to make sure that you're safe, you're healing well. We could do any adjustments if they need to be done. But that takes a lot of work to do. And that's why I also just only have one location over here, just to make sure it's done always at a very, very high level. Pitted acne scars on brown skin. That's, I had actually, today was interesting. I had a lot of patients with Fitzpatrick 5 and 6 who had very pitted scars, deep ice picks and deep boxcar scars. Really it's about excision for a lot of patients for that. Subcision, going inside, breaking up that scar tissue. TCA Cross, really, really useful. And sometimes you could do a laser, especially like the erbium laser, which has less heat. If we could get away with it, we could potentially do some of the CO2 laser at some of the edges there. But, it depends on how good you are with sun exposure too. So I'll do a lot of things to make sure you're very, very safe. But if you do your job and making sure you don't get sun exposure so we don't run into problems online. Awesome, Dylan. Look forward to seeing you. Dylan saying that they'll see us really soon. We don't tend to do like deals per se for scars, but there's memberships that you could do that could help you out with volume and things like that. So you could talk to my team and they could potentially help you with that. Does Accutane remove some scars? It can help a little bit with some of the superficial scars. A lot of people that have been on Accutane will find that some of the superficial scars improve. Sometimes the redness, the inflammation goes down as well. So that's good too. But the deep scars that we usually show on here are not going to help too much with those, to be honest with you. Did I used to have scars? Yes, I did. It wasn't, I always say that like I used to think it was very deep, or at least it was like more obvious to me. And I was aware that people had worse scars, but like it just felt like it was really serious, and that everybody noticed it to me. And I used to feel like it that way, and I was like very self-conscious of it. Now that I've gone on this side of the world, I've seen that like there's so many worse cases, and everybody that has very severe cases will say, "Is this the worst case you've ever seen?" And no, chances are it's not even the worst case that week actually. It doesn't, I'm not downplaying like the effect that it's had on you and the severity of it, but we all sort of seem to think that we have really a lot worse skin than we do. And sometimes it's sort of like taking a step back and recognizing that it's not as bad, and sometimes it's not as noticeable as you may think. And fortunately, there's options here to improve it and improve it better and better. There's different steps to take, especially when it comes to like volume replacement. One of the big things that lags for a lot of patients is volume. We have to sometimes just put volume and go slowly with that. Put a little bit at a time, and you can just be really meticulous. We could do that. H is asking, Doctor, I want to shadow you. Where can I contact you at? What are you? Are you a medical student or a PA student? What's your background there? Where was that? How can you tell deep or superficial your scars are? Well, it's it's probably going to be a little difficult for the vast majority of people, but one like easy way just is for like common people to be able to tell is the distance you could sort of see those scars. So, sometimes you could see it from like 15 feet away, 20 feet away. That's definitely very severe scarring. If it's someone that's like only really under certain angle lighting, under really harsh lighting, you can see those scars. Chances are those are pretty shallow scars. And, that's probably a good gauge for you to be able to see like the distance that people could see those scars. And something to kind of pay attention to, really. I always say that, we aren't actually looking, day to day, people aren't looking at your skin with like flashlights. Just because I do that in the practice, in the office, and I'm using very, very harsh lighting, don't expect that to be the case always, for people, nobody should be doing it. Nobody should be shining a light at your face and like seeing what the scars look like. You just don't let them do that. And they're terrible if they're doing that to you. Nix is saying that he has acne scars. I'll be happy to help you out, Nix, at some point. Britt Ann is saying, how long does filler last if using for volume loss? It depends. It depends on what's happening with your volume. In terms of like deep lots of volume. Sometimes we'll use like Sculptra, for example, or fat transfer. Sculptra could tend to last for the volume portion about 2 years. And then it's a fat transfer, 50% of it does go down over the course of about a year. And the remaining bit actually just stays there, and that'll continue to stay there, just like your natural fat. Bellafill is a different product because we could do it really for the full face if we need to. But 20% of it does stay integrated there. And at least we know for 5 years for sure. But most people in the practice could say that it's really for a lot longer than that. Likely it's going to be semi-permanent to permanent. And there's always like that 20% that's there. And around it, there's some collagen that's around there. Oh, awesome. People are saying that they're watching it on different platforms, which is nice. Tanya is saying, please answer. Tanya, I missed your question. If you could, and there's a lot of questions that I probably missed. So if you could just repeat it, I'll be able to get that back to it. Do all acne scars need filler? I would say more often than not, actually. Interesting, right? More often than not, acne scars need some sort of collagen-based product. And some sort of product like the biostimulatory products like Radiesse, Sculptra, Bellafill, and it improves a lot with it. Now, sometimes obviously if it's just like one or two little indentations, probably not. But more often than not, scars need volume. So that's something to really pay attention to. I'm a really, really big believer in volume when it comes to scars, like a really, really big believer. I think that almost anybody could tell you that they've done things and they could see that the texture gets better. But if they didn't do anything for volume, they're still going to see indentations. They're still going to see volume loss there. So pay attention to that. Like if you're going to somebody and they're telling you, we got to do 10, laser sessions, we got to do 20 laser sessions, and they didn't tell you to do volume, probably run, because it's like, I don't know why they're doing it that many times. I'm not sure. And then also they didn't even address the volume issue. User 24 is saying, I'm scared of filler. I was scared of filler too when I came out here, honestly. I was telling everybody, like, I came out here and like, I was from Chicago and I came over to Beverly Hills and I came over to Newport area, and I was like worried about the way it was, and I was like worried about the way filler is. But there's a whole way of doing filler, and it looks awesome. I did several filler cases today. It looked beautiful. I'll tell you that. It looked awesome, especially like facial balancing, temple area, chin area, like the angle of the jaw. It looks amazing for some people. PK Farnsworth, how's it going here? PK Farnsworth, you're always very, very polite. PK Farnsworth is saying, thank you for your talk tonight. How do you incorporate Visia skin analysis in your practice? Is it something that you walk through with patients also? Yes, I mean, typically more for like the pigmentation portion of things. You can't see scars as well on the Visia, but you can see like pores a lot of times. Sometimes you can see ice pick scars really well for that, but you don't see like rolling scars particularly well. Sometimes like boxcar scars not too well. So I use it more for like the pigmentation. And honestly, I've discovered a lot of issues sometimes that have helped me out, because we could sometimes have it where you could see patients will not realize that they had so much hyperpigmentation or sometimes even lost pigmentation, and we could point that out on the Visia. And then also for some patients, like for the red marks, the red vessels that are there, we could really map that out. So before we do the laser, we know exactly how to laser that, which is awesome. What acne scar treatments can be done with low recovery time, less than 4 days? Well, that's not going to be too hard, actually. We could probably do more like if the volume replacement, subcision just takes 4 days. And even most lasers, if I do it just like with certain energy points, we could actually just get you going in 4 days. So I could do that in 4 days. Just let me know. Honestly, I always tell people, just let me know how much downtime and I'll work with you with the downtime. Oh, I'm glad you love your lip filler, Jen. Thank you so much for stopping by. I've done CO2 3 times. I'm 48 now. Still not satisfied with the results. Thinking about a mini lift. Thoughts? Well, I mean, if you're thinking mini lift, really almost anybody would tell you consider the full facelift. Consider that. So I would recommend doing a full facelift instead of just doing a mini lift if you really do have true laxity. A mini is not going to last long. Yeah, Tanya, for some reason I don't see like your full questions. I just see you say please answer. I see that you asked again, but I don't know why I have not seen like your actual question. Very strange, actually. What's my skincare routine? I usually use my pigmentation cream at nighttime, and then I use moisturizer, sunblock, and that's pretty much all. That's usually what I do. I actually just started playing around with this Korean brand. I have to actually figure out what it is. Actually, now that I just said it, I'll look at what it is because a lot of patients were saying that there's some good like hydrating ones. So I actually started using this hyaluronic toner. I'll give you the name of it. It's actually really nice. I actually really liked it. It seemed like it gave me like a little more fresh look there. Does tretinoin help acne and acne scars? Yes, it could help with the like mild ones. There was someone on here that was saying that it did actually help with their scars as well, because I was recommending 0.025, and they're saying that the diameter of the scar reduced actually, which is awesome. So it could help. It's the oil production sometimes increase the diameter, and you may want to shrink that. Jas is asking for moisturizers that are for extremely dry skin, no drugstore, no Cetaphil, no La Roche-Posay, please. You have to double check to see why you're excessively dry like this. Is it like true eczema? Is there something else that's being missed right now? But I got to double check. Really, all those are good options. You don't really need to do too much more than Vanicream, CeraVe, Cetaphil. There's not really many other reasons why you need to step it up, but unless it's something that's like, do you need sometimes like occasionally like eczema patients, you may need something else that's, even like occasionally even like something with urea can sometimes help as well. But I'm not sure what exactly like you mean by excessively dry skin that's not responding to regular moisturizers. Like, are you using other topical exfoliants, or is there something else that's exacerbating that dryness? Oh, you're using 10% Panaxel benzoyl peroxide. Well, that's the reason why. Yeah. So when you stop that, I'm not sure when you stop that, but that's definitely going to dry up your skin. And so now we have to just sort of just really re-moisturize and use CeraVe. Just honestly, just use a lot of just soak with CeraVe, put it on multiple times throughout the day. And you could actually do silicone tape at nighttime, and that actually helps lock in moisture too. So try doing that. Silicone tape at nighttime, just use it all over your face. It's actually going to help repair that. Do that for like a couple weeks. You'll see that. Can I treat, Melly's saying, my 2-year-old daughter has a scar on her lip from a dog attack. Will she have it forever? My other patient today, she was calling from New York, and she said that she had a really bad dog attack on her nose, and apparently she was trying to remove something, I think stitches or something like that from her dog, and it was like a Doberman, and he bit her nose. Really terrible because it got a cause of severe scarring. It's fixable. Like the nose is a little bit more complex. The lip actually, likely we should be able to fix that a little bit better though. So you should likely see somebody nearby your area that like any reconstructive surgeon should be able to take care of that. Hopefully it's early enough where it's not going to cause like long-term cosmetic issues, but that's something that should be something solvable. So don't think that it has to be forever really for something like that. Can someone who is very scared of pain still get treatments? I mean, a lot of my patients are, to be honest with you. A lot of people are, and I usually end up doing a lot of nerve blocks with them. We could also do something like Pronox, which is just basically nitrous oxide. That helps as well. So a lot of different options, really. It's not necessary that we have to do like heavy stuffer, I should say. There's a lot of ways to make you comfortable. So I think that there's like almost no limit sometimes in the different options that we could do. And if we needed to, we could do oral medications, things like that, to really help out with it. Oh, Tanya, there you are. Now I see it. You know what? I bet you, by the way, the platform was blocking you because you were using the term cutting, and sometimes they actually flag things like that on here. So just so you know, I think that's the reason why. So Tanya is asking, when cutting acne scar tissue, what method do you use? I'm concerned about sagging. Well, there's a few things, there's several things. Basically, one is that I mostly do blunt cannula subcision. So I'm going in there with a blunt tool and I'm checking to see where the tension is. I'm feeling each individual area to see where that tension is with my fingers. And then if there's certain localized spots that are stuck, then I may use something like a Microneedle, where if it's for superficial areas that are stuck, I usually use that to break up the scar tissue. If it's a little bit deeper, a little like what's called intradermal area, and it's stuck, then I use something called, in a localized area, something called talar liberator. And typically when I'm doing that, I'm usually just doing it only in the upper part of the face, like along the cheekbone for the talar liberator. For below the face, what I'm doing is most likely just going to be blunt cannula subcision, or sometimes occasionally I'll use that Microneedle in that area. And then it's more just for, like, again, a localized area. So those are the ways that we could avoid that concern for sagging. But remember though, just from acne and from scars, a lot of times you'll see like this tension, it's pulling down on the skin, and when you're smiling, it stretches out the skin, and that causes sagging too over time. So, just something to pay attention to, that you may just get sagging just from getting older. I'm not saying that that's the reason why that like everybody got sagging, if they ended up getting sagging from Subcision. But I know that it tends to, the concern from sagging tend to be really from, a couple different practitioners, and they likely were doing techniques that weren't, the best practice, to be honest with you. Sometimes it may have been a bit too aggressive, and sometimes they may use a little too much force for certain areas than they should be. So someone's asking about combining benzoyl peroxide and clindamycin. What's my thoughts on that? It's a good option because it can help prevent antibiotic resistance, but I personally prefer using more Dapsone with clindamycin if I was to use that. Reason why is I find that benzoyl peroxide is just overly drying for the skin. And in general, I kind of stay away from like long-term use of benzenes. You saw, hopefully you guys saw that there was a study that showcased that benzenes actually really is a carcinogen. So long-term use it's a little concerning to me. People will argue and say, well, there's no proof that there's no evidence that doing benzoyl peroxide will cause cancers. But like I'm really somebody who's like, do you really have to wait for that proof for some, like, are you going to really sit around and just wait for cancers now to happen? It just doesn't make sense. If it is something that's a carcinogen, why not consider an alternative like a sulfur-based medication, which is excellent. I love sulfur-based medications. It works really, really well for when I had acne. Sulfur-based washes worked out really, really well for me. So I don't really love I don't love the benzoyl peroxide as much like that, especially long term. So that was answering your question, Babyface. I was talking about Captrio there. That's that combination of benzoyl peroxide and clindamycin. I know some people didn't know the brand name there, so I was just trying to help everybody out there. Let's see here. Where was I at? I missed a few things, so I'll try to circle back with people. Have you ever used a skin pen for acne scarring? I don't think it's going to be too helpful. I mean, I've had microneedling on my own face. It was not helpful at all for scars, so I did not think it was helpful. PK Farnsworth is saying, I was scared of fillers too until I realized over time that I needed it for further restoration. I avoided fillers for about 2 years, and now I'm definitely on board. I'll be happy to help you out, PK. I'll be happy. I mean, I love doing fillers. There's a way to do it. It's very, very natural. Like really, even your own mother wouldn't know she did it, to be honest with you. It's just soft, subtle, like some select spots. And I just do it in a way that it just looks like you're fresh. And we can do it that way. I love doing fillers. It's like one of my favorite things to do, just like, especially collagen-based products. It's like over time, looks awesome. It's like the balancing effect is really, really amazing for a lot of people. And, I focus a lot on scars and things like that, but also like aging process does get depressing for a lot of people. They start noticing that there's volume loss in their cheeks. They start noticing that there's some skin laxity. And, it gets distressing for people, and it's like, it brings them down. So it's nice to be able to have options that aren't necessarily surgical, and we can basically put things in there that support the tissue and make the skin quality better. Satana is saying, will Bellafill or fat transfer cause nodules for long term? I mean, there's a low likelihood of those things. Sometimes if you have autoimmune conditions, that could occur. If it wasn't done in a completely sterile manner, that could occur as well. But it's an extremely low likelihood of that. And that's one of the reasons why I don't recommend doing fat transfer for some of those like more superficial pockets of fat. A lot of times I want to go a lot deeper for fat. If we're doing superficial, it's more like just stem cells, which is not going to give you any volume. It's just improving the skin quality. Bellafill, you could place superficial, but I'm doing very, very tiny little micro droplets. It's literally like, it's microscopic. So I'm just doing little bits in each of those little spots. And that's what I do. That's what I prefer. Should I be worried if I have deep acne scars after doing 4 Bellafill treatments within 1 year? Not worried per se, but maybe you need a subcision. I've had patients that they had several rounds of Bellafill, but the Bellafill went around there, and they should have done subcision really, and that would have helped them out. I missed some questions on here. So, Sean, the site is saying, are the prices on your website for one single procedure, or would those prices cover the 2 times the patients would need to come in for CO2 laser, etc.? So we actually, those prices are for a single time, but we do have a warranty program. And I'll tell you a little bit about that. Basically, it's something that I wanted to have where everyone asks about cost, things like that. So the first session, I'm really trying to just like knock it out of the park. We got excellent, amazing results. And then what we have is that future laser sessions, if you need to do future laser sessions, it's 55% off. And, I say up to 55%, but it's actually 55% off. But like really, it's, pretty awesome. So TCA Cross, 55% off future. Like you did the combination session, you did what we needed to do. Now future sessions are that way. So awesome, right? So consider that, consider doing that, because it's like I make it so that I could do things at a very, very high level. And I make sure that when I'm doing the laser, when I'm doing subcision, when I'm doing anything, it's done at a very, very high level. And it's fine with me. Like I'm happy. The fact that like, okay, we did it really well. Next session, it's like usually not going to take as long, but if it does, okay, we have to do it. We have to do it. Whatever it takes. I just got to get you guys through this process so we can get excellent, beautiful results. I want everybody on this chat. You can see all the people that say that they're patients of mine who are so happy, all that. That's what I love to see. I want that, or like we've solved scars. Everybody knows how to solve scars. All the people out there in the world know like that there's ways to solve scars, even if it's not necessarily with me. You guys know that if you have scars and you're going to somebody and they're telling you things that like I don't do, really strongly consider, or just come on here at nighttime and just ask me about it and I'll tell you, and it's like, sometimes it's okay. Like, and it's fine. But like, sometimes it's like, I don't know what they're talking about and I'll tell you. And it's fine, because you guys should just have more, you guys should have an advocate. You guys should have something that's like going to help you out in life. And it should make sense that like, you're working on something that you already suffer from. It wasn't even your fault. My patient today, she called me from Louisiana, and she had severe acne when she was 10 years old. And she couldn't afford for a dermatologist. She has such severe acne scars, and she's an African patient, and severe acne scars. A lot of that could have been avoided with proper management of her acne. And it's really terrible. It's really terrible, and so I always say that I always want everybody to know that whenever you see scars, don't judge people with this at all, because just think that there could be like socioeconomic reasons for the reasons why they had scars. And like, why are you judging somebody based on that? That's not fair. It's not fair that somebody didn't have access to a dermatologist, or even if they did have access to dermatologists, a lot of people were just terrible sometimes to them. Like doctors were terrible, possibly. Sometimes like people make decisions and it's not even necessarily their fault even. Sometimes I hear that like my mom or my dad didn't want to place me on Accutane at the time because they were worried. And, it kind of makes sense too, because they were concerned about some of the side effects of Accutane. So it's like, there's so many different factors out there for why somebody may have those scars. But instead, sometimes, not often, but like every once in a while, I'll see some comments on my thing that say, oh, stop picking your skin, or just use this face wash, or do this cream, or do this thing. And it's like, dude, it's not about that. A lot of people don't pick their skin. And even if they do pick their skin, it's like they did it when they were 14 years old, they're 15 years old, 16 years old, just relax about it. And sometimes it's because they went to esthetician or someone else, or like their parents, and they, it wasn't even them. I had a patient, he said he never picked his skin, but his mom tried to extract them all, and that's what caused the scars. And he was upset with his mom about it. But like, maybe she was trying, that's the best thing she could do. And it's like, okay, we're going to work on it now. One of the big things I really want, like this year, my whole theme is going to be about forgiving yourself, really. Last year was about just like the positivity about like the fact that we could get amazing results and you could improve. And like, I wanted you guys to be optimistic and see that there's hope out there. I think people could see that. And I think there's a lot of patients that are out here now that see that. But I want like people to really forgive yourself, forgive your parents. It's like as long as they recognize that like and are supportive of you at this point, at least, they're by your side for that. You should really forgive them. If they made mistakes when you were 16, 14 years old, maybe they were like, they didn't want to see you suffer, and that's the best that they knew. They didn't know how else to do it, and they couldn't afford, or was scary to afford a dermatologist and things like that. I mean, it's expensive. It's very, very expensive stuff. I'm fully aware of how expensive this stuff is, so it's like, really, that's the theme. If you hear it a lot, it's on purpose, because I hear it all the time. And it's like, I was thinking to myself, it's like, how often are patients like, just like, going in their mind that I shouldn't have picked this thing. I shouldn't have done that. And it's like, sometimes like you're 14 years old and you're upset with yourself when you're 14 years old, when you're 30 something years old now. Just think about how many other mistakes you've made at 14 years old. It's like, just, you got to forgive yourself. Like, it happened. And it's like, that's the first thing. Before you forgive other people, just forgive yourself that it happened. And like whatever issues that happen with that, it's like we have to just be able to like literally sit down and actually think about it for yourself. You were like, at one point it just happened. And now it's like time to just like, you just let that go, and like, just be like, you let yourself heal. And now go through this journey, whatever journey you need to do, or don't go, you don't have to go fix your scars. If you're just like satisfied with it, it's okay. But at least just like feel better about the fact that at one point in your life, when you were younger, or just like you were stressed out about that particular pimple, you did it, you pimped it, you picked it. And a lot of people pick their pimples, and a lot of people don't scar. You happen to scar. It like happens, and it's, it's tragic, but it happened. We'll work on it. So there's no point in like going back on that. I appreciate you, Tani. Thank you. Tani's asking, when cutting scar tissue, do you always inject saline? Wouldn't that cause the skin to stretch too much? No, the skin really does retract really with that. That's something actually that there's a dermatologist named Dr. Jeffrey Klein. He recently retired, but he actually showcased a lot with tumescent anesthesia, and it worked out really well. He basically showed with the lidocaine toxicity levels that you could have with tumescent fluid, and just like the consequences of putting it in there for lidocaine purposes. And then afterwards, a lot more people were just using it, and we really saw that really the skin does contract very, very nicely. So we've been doing it now for like 22 years or so. There's more than enough evidence and data that really it's not going to be much of an issue with stretching out the skin for a bit of time. In fact, it's actually going to help us out, because we could then glide and then break up that scar tissue really, really well. So, I hear you. I can see the concern, but that's something that swelling reduces really, really rapidly, just in a matter of a day or two. It's just you're going to be peeing that out. Forgive and you will be forgiven. That's right. Yeah, I think that. But I think really it's not necessarily about forgiving other people quite yet, like until you really forgive yourself, really. I think like that's one of the biggest things that people kind of forget. Everyone sort of says, well, just forgive the person, forgive the person. Sometimes you may think that like, you have to forgive people, but like, first of all, I don't know, everybody's necessarily worthy of being forgiven unless they really like showcase that they're apologetic and really you understand, and they understood what they did wrong, and they're going to like make amends or do something else. But like, for yourself, at least start with that, just start with like forgiving yourself, really. Because I think some people are just way too hard on themselves. Really, and it's the biggest problem is that really people just go back and forth on being too hard on themselves, and you just go through the cycle. Let's see here. How did I get into medicine? I will go through that at some point next week, because I wanted to make sure I was just mostly just at 30 minutes tonight. And so I will go do that. And I saw a question on verporphin. I'll talk a little bit more about that next week as well. Not much more to update though. Just waiting for IRB approval at this point though. Nothing else going on with that though. I got the FDA waiver. Just waiting for IRB portion of things, and it's just like to just adjust the study design. It should hopefully be soon. That's not going to take as long as the last process. So hopefully soon. All right, guys. Thank you so much. I will see